So Wayne, so your journeys in terms of BPH, Defender the Trucer, has been more than 15 years. It's not, even though in the media, this crusade is something recent, but definitely you as a urologist, it's been a long, long time. Because you did a fellowship. So in terms of vast fertility, so that patient drove you more to, hey, there's a real problem in terms of BPH. We need to be more active and treat these patients.
Well, I think, so as you know, or folks may or may not know, I was on faculty part-time at the University of New Mexico doing male fertility, and I had a combined position with a large urology group practice in the community, which I was with for 8 years. And then about 2010, I started the Southwest Fertility Center for Men, where I could really focus on male fertility, vasectomy reversals. And then in 2014, I opened up a solo practice called MD for Men. And it was really an experiment or adventure into understanding, how do we create a place that is the go-to place for men's wellness, the go-to place, a place where men will tell another man, hey, that's the place you need to go to. We're building community. And with that, it was the mission that how do we empower men with the guest experience to evolve fearlessly into the best versions of themselves? And part of that, so vasectomies, testosterone, Peyronie's, erectile dysfunction, BPH, they're all really part of men answering a simple thing, which is, what am I scared of? And we have to help men face, embrace, and move through their fear so that they can become the best version 2.0, the best fathers, the best sons, the best colleagues, the best bosses. And that was kind of how we started out. And I wanted every pathway within the practice to be simple, safe, effective, efficient, and personalized. And when I came to BPH care pathway, over the first 10 years, there was a cognitive dissonance. There was something that wasn't quite right. I mean, Jose, you and I trained for years to be solution-finding surgeons. And yet I found myself being a pill-pushing physician. And instead of helping men be the best version of themselves in the operating room for BPH, I was mostly taking care of them in the office. I'm guilty of doing the prescriptions and the refills. And where else was I taking care of them? In the emergency room. When they came in with stage 4, late stage BPH retention, coaching for other physicians and other groups, the number one thing when I ask is, hey, when was the last time you were called from the emergency room for a guy in retention? I mean, for you, Jose, what's the largest volume you've been called about?
5,000?
Exactly. 3, 4, 5 liters. And then if I ask the secondary question, what % of those guys are on BPH medication?
Probably all of them.
80%, 90%?
At least on Flomax, yeah.
Exactly. And so it creates this cognitive dissonance. What am I doing wrong? Because here we have all these guys showing up and I am following the guidelines. So there's a disconnect. There's a cognitive dissonance. There's something wrong with the system. And I was part of that problem. And so I recognized that I was just trying to be a great urologist. And how was I doing it? I was towing the party line. I was following the AUA guidelines, but it was not happening. The healing and the curing wasn't happening in the operating room. Like I said, it was in the office with prescriptions and in the emergency room with Foley catheters with guys with late-stage BPH. And I had become something that I wasn't comfortable with, which was a pill-pushing physician instead of a solution-finding surgeon. And what I realized is that, and this is over a whole decade, is I was straying too far from our Hippocratic oath, right? We understand, I think I became so fearful that I was going to harm someone by doing something that I should not have done, like a surgery, prematurely, potentially, that I forgot that you can equally harm someone by not doing something that you should have done, like intervening soon enough within the window of curability to save a bladder, to prevent that late-stage BPH. So really kind of understanding that and recognizing that in my world, if I wanted to create a pathway that's simple, safe, personalized, effective, and efficient, effective, right, is doing the right thing. I recognize that just managing symptoms with the AUA guidelines, we could elevate that. We could do better. And for us, it was prioritizing the preservation of bladder health. That is a higher calling that we all can share and believe in. And then to be efficient, I needed to recognize that It's not just in the treatment and the post-treatment phase of the care pathway, but actually in the pre-treatment phase. What are we doing before we treat to optimize how we make that decision with our patients about the right timing to intervene for a mechanical problem that deserves a mechanical solution?